Honorable Member of Parliament, heads of the ladies and gentlemen, I'm happy to be called upon occasion. And I would like to put on record that if there is one event COVID-19, today, our former finance minister, Honorable Setepe, was supposed to be here, but unfortunately had to Accra and has asked me to operable to COVID-19. On behalf of the Municipal Assembly, where we have beautiful ladies, the men too are very handsome, and maybe you open your eyes and you have your life in Somalia here. Note, I welcome all of you to this important occasion and wish you all the best. Thank you very much.
Thank you to the powerful welcome. Oh my. Eminente, from MC, why are they? Why are they? On the program, we have some poetry recitals and some other things. But before then, let me take this opportunity to introduce to you or to acknowledge some of the personnel, some of the dignitaries and dignities that are here with us, so you know them by their names. I'll be doing it in badges, so if I finish with this, I'll come again and continue. Wherever I find some little chance, I'll just chip. We have Dr. Abuaji. He's a Director General of Health. He's here in our midst. Yes, Director, thank you very much for coming. Then we have Dr. Franklin Asiu, also in our midst. He is the country rep. Thank you. You're welcome, sir. We have Mr. John Bawa, rep of PAC. If he's also here, can we just see him? Oh, wow, wow. Thank you for coming. Thank you for coming. We have Dr. Nagai, Henry Nagai, and he's the chief of, okay, Party JSL. Say, when you wake up, you just wave us so we know you are here. Thank you very much, sir. Then we have Mrs. Eunice Baden, and she is the rep for CDC. Mrs. She is. Let's put up for them as they wake up and shake their hands to see whether that they are really here. Okay, then we go on to Sylvester Sebaya. Breakthrough action. Thank you very much. Maka. Vice UK aid. He's also here. Where is he? Oh, thank you, madam. Thank you, madam. Ozua Maka. Hey. So let me pause here and go and come. I'll continue with the introductions. Now the program it is poetry recital and we have the Mount Mary Training College or Mount Mary College of Education here do some recitals for us. If they are here, with a round of applause, let's welcome them. Let's together they come. Wamanu asile, ne asile wanyemi me ne aje Mount Mary College of Education. Le amap. Let's put our hands together for him again. Inganye. Yemeji at the rich one, could you?
In a chose Mrs. Mount Mary College of Education. Suku, ne echosia choli. Kehani Kasemi Papa. Neneme Nikota Mene Apenomina. Your Charlie Suku Bime Kenipa no Ape Inganye Manye Mune Jepongo. Ejakaji ke kiaya mi tesi jo ina ni mi bere mi la famille ayomi bubu ina ni mi better. Coronavirus, along COVID-19. Boy, I don't know. I'm gonna do. Oh, funny, I can see me. Let's you know. Oh, no, no, oh, Ganame anoyemi, jishia enyakumi. Jia tuona mkwai. Eja kashia na. Sema yo, ma. Jukoi. Nikaseli. Notipali. Ketupopeli mbloi fun anokaba. No amogu. Efye na okeje wakati. Ne loji. Wamogu chupake wa no chuomi. Me. Jina. Vaccination. AstraZeneca. Ekonke Johnson & Johnson. Ekonke Moderna. Nenene pia wahami poti. Chupa. Yehu manyama kuchupa no. Nila eti anyamaka enu. Nyamunya manyama ku. Yehu sisi kwa. Manyama. Mo. Ne. Ogun. Zini. Yes, it's okay. You know what I want to do? Say, Ila, mother, you can you buy? Yeba, no must see any can you buy singing up there. Then you bring me to it. I can't quite a lure. Let it at home. Make a demo here. Machuni. I know I like my comment. You heard him playing, you know. I can't go to prayer. Let your body on it. No, your portfolio, it will appear 660, sir. I can't go with your plan. It's okay, be a soup. A penny, I know what I buy you. Can I buy it? Okay. Can I be to plan? Let you. Polio. Can you say that you can?
Country Representative WHO, Dr. Francis Kasolo, Honorable Member of Parliament for the area, Honorable Abed Tete Nyakote, my good friend from UNICEF, Chief of Nutrition and Health, Dr. Mona Shete, Director, Public Health, Dr. Franklin Askedu-Bekwen, that was introduced. Development partners here present, Deputy Directors, Ghana Service, and National EPR Program Manager, Municipal and District Directors of Health Services, Medical Superintendents, Heads of Departments, traditional leaders here, security agencies, colleagues, staff, students, members of the press, distinguished invited guests, ladies and gentlemen. Good morning. I deem it a great pleasure to join the Honorable Municipal Chief Executive to welcome you all to the Eastern Region, and specifically to Somanya in the Yellow Robo Municipality, to participate in the national launch of the second round of COVID-19 Vaccination Days campaign. First and foremost, I want to express our appreciation to Director General of Ghana Service and the Ministry for the choice of Eastern Region for the launch of the second round of COVID-19 vaccination. We appreciate it very much. So DG, we are very grateful. Indeed, when we were asked to host this particular event, we have 33 districts, and we have to make a choice. But we decided to hold it in Yellow Cropo for a simple reason. During the first round of COVID-19 vaccination, I was personally in this district with Dr. Francis Casolo, WHO country representative. And we went around the communities, and we were very excited because while we followed the vaccination teams from house to house, every house we entered, we were warmly welcomed, and people were receiving the vaccines. So we thought that this would be a good occasion to honor the people of Yellow Cropo. And that is why we are here today. And we believe that our choice is right, and the people of this district, and indeed the entire traditional area, will not disappoint us. Nana Chairman, the theme for the campaign is protect yourself, protect your family, get vaccinated against COVID-19 now. Eastern region, like other regions, recorded a total of 7,039 COVID-19 cases since the first case on 31st of March 2020. The Eastern Regional COVID-19 Response Team, under the leadership of the Honorable Regional Minister, employed all available resources to respond to the pandemic in order to safeguard the lives of the people in the region. Regrettably, 148 persons, constituting 2.1% of persons who got COVID-19 disease, could not survive. They lost their lives. And this also included some of our health staff. Indeed, we had a total of 1,456 health staff getting the infection, out of which 6 also died. And Chairman, you will agree with me that the COVID-19 pandemic has negatively impacted on every facet of our lives. The pandemic has put a huge strain on the healthcare delivery in the region, not to mention the huge economic burden it has brought onto us. No wonder it was a great relief when the restrictions imposed were relaxed a bit by His Excellency, the President, in the last address. And Chairman, it is heartwarming, however, to know the region has recorded low numbers of cases since January 2022 to date. The region currently has 0 cases, but this is not an indication that the disease is gone. Indeed, when you study the history of the previous pandemics, We always have periods of remission where the disease goes down and then resurgence. So we want all of us to understand that we are still in the pandemic, and there is the risk of recording higher case numbers if we are not properly and appropriately protected. Of the many options in fighting the outbreak of infectious diseases like COVID-19, the best bet is protection of susceptible individuals through vaccination. Vaccination will protect us from future surge in cases because then we have the appropriate resistance against the pathogens. And Chairman, ladies and gentlemen, the Eastern Regional Health Directorate of Ghana Service aims to vaccinate a total of 2,439,756 persons against COVID-19 disease. As at the 17th of April 2022, the region has administered a total of 1,272,842 doses of COVID-19 vaccines. A total of 898,807 people, that constitutes 36.8% of the target population, have received at least one dose of the vaccine. And 536,976, representing 22% of the target population, are fully vaccinated. In addition, a total of 21,078, representing 3.9%, have received their booster doses. It is very clear that the region to vaccinate to ensure that are fully protected from future outbreak of this terrible disease. We are gathered here to launch the second round of the national campaign to vaccinate all persons who are eligible for vaccination but are yet to be vaccinated. That's persons above the age of 15 years, including pregnant women. I wish to urge all persons who have not received their vaccines to make themselves available to be vaccinated. And it's ladies and gentlemen, I think it's appropriate at this forum to also make this small announcement. We have our new automotive yellow cover district hospital. And all of us have been anxious right now to receive services at this facility. Announce that the facility is now open for services to our people in the district and the surrounding. We still have a few problems. The major one is water. Honorable Minister of Executive is working hard on this to make sure that the water flows continuously at the facilities. As a result of some of the all the facilities that we have, we waiting
Nana Shite, the Chief of Health and Nutrition from the UNICEF Ghana office. Thank you for coming, sir. We have Alhaji Suleimana Salifu Ahmed from the Chief Imam Office, Eastern Region. Thank you for coming, Alhaji. Please permit me to also go to the districts so that I can introduce the dignitaries who are here. We have Honorable Albert Tete Nyankote, the MP for the area here. Thank you for coming, Honorable. We have Mr. Eric Heaney, the Municipal Coordinating Director, also here with us. Thank you for coming. We have Madam Beatrice Ohineba Inti from the Forestry Commission, also here. We have Honorable Presiding Member Robert Agede, also here. Agede, also here, thank you. We have the Social Services Subcommittee Rep, Honorable Amano, also here. Honorable Amano, thank you for coming. We have the District Director of Education, Madam Veronica Tete, also here with us. Thank you. The faculty and staff, Einstein Global College, also here. Thank you all for coming. We also have our District Directors of Health Services from the Eastern Region who are here. Please, let's see you, those who are here. District Directors of Health Services, thank you for coming to grace this occasion. And we also have the heads of department and institutions, Ilo Krobo, also here. If you are from any of the department or institutions in the municipality, please wave at us so that we can give you a round of applause. Thank you all for coming. So I will hand over to my co-MC to continue with a summary of what the regional director said in the local dialect. Thank you very much.
Thank you. Let's put our hands together for him. Ipanye penene denga aflane gbion istane magblem boko kone monene aflane gbion nu papako no sisi. Piti wo popeji kan efo nene mechuwepe ame block kan e matumu nyukecho. Nene de wo chuwepe ko COVID-19 nene ji hiyo neba ne piyo no logic kan enge hiyo we ya ne ebie popale bachaki kula piyo no ne toka COVID-19 wuche ba piye no engla ne mahan wo ni siembo etonya kan ne hiyo no decision Ghana matuwepe wa mekpe chile se basu be ko mam drominya to pan ba jekpo na boni gbom no e ke na decision angani awemi ai na angagbo ha me do ko bene ya na afiele ba basu e ko kene ke aya no fe no ko ke wa gbomomo ya ngo certificate low card ne to kan ogbomomo ke ba hu no enne ne ma ngo ke ba ko bele hu e ken agbomomo e no ha ne nyagba boko boni bam no e ta no ne de wo ke piano ko hiya wa puje popa no no ngeyo me no wangede ke hiyo etan hiyo tan se elani made wanu kwale kan COVID-19 hiyo enge lo enwo akota ko make fosin ne chon nimli yabo ne agbochopan no nge bene chopan bape ne echo wala fa migbagbe hu pene enge angale jon jano se hu nimli ne agbo hu abayo ne piano ka hiyo akota nge mede ke woni ne wagbon nge puje popa no no wai boni hiya me no pe nene mene agbochopan no eno ijo eke nyagba bo nge bai lo nikota mai na hiam ne hiaka mweno ake blonya tomino neji vaccination lo chupa no gbomio e blonya tomio ake e bopam e ba waklo hiyo mino nge somanya peni pia na e gogon fiamio e se wochuwepe watuem e peti opomio e palede woken wa hiyo chame ehe ne amawo nge kosu disu assembly municipal assembly blone gba o hiyo no ke ya yoku wono manaka ama hospital lo yo chame fine ko ngale jon be sign mi jino woni fu wa be ngale jon wa si bieke mini be ama bli yo chame he no nyahawo ko ne wa nane wa ya yo chame ngale jon se mo no ma drominya eje nyagba me to pekete blom engla de kloma to peken ablinya o ablinya ne ka je wo ma je wo ne o he ko ngamo yeyo o manyene o ma ya le jon nyana wa fe adem eke ablinya no se anganya gban kome nenene efia no wawaji nyu eke nyu epe anyagba ngalejon ne yo chame leke nyu bepe muncho mana ni ne eke ba eno ejo pape samenya ka ne municipal chief executive ngeyo ne jano se wa mami director of health ngeyo ne wonchame wakpani chechu wepe hu hinsinga sem no maye kan bi kai nyuma sulejon wawe na bim fong ble daligbi nyumai by penepeane anyene ake hiewo nenemene ekwo wa yino makon wolo noko makon wa hio ko wasulejon anyene ahiewo fine idai no ne ngoto mama gbo kaya ha neneje wa mami ne das nga yocham eblonya tomio enya nga wakolo hio mi no kaja no se ho wa municipal chief executive neji wa MCE ke sapaten tano macheme ke neneji wochuepe wakono ka abomodi nene akaka blonya tom no mahio asoli ato eblono fine na epefew ne wakenge nyagbe epie bono amagbenya no eke ehanyi tuwe petum maune jonye ka ne akema nye pila nini se nye soli ne nye fuale ne nye yeboa ne ngemuye maune jonye tuwe pe amen ikwa nye pe wafi adim. Then up next on the program is a brief statement from stakeholders, religious leaders. Loheji ohene wasuo wamanu segbi piti kemaje nine ayi okeboa loko blonya tomno mekake no yano ne kekelekele wa mahi energy wa somomi alo wa hem ke yemku ine wa nwa ke womiume loko na manaka wa Christofoli ke jano se hu Muslim jali hu nge hiomino ipo pe kekelekele. We are inviting Reverend Father Bright Kennedy Ejapon, to give us the first brief statement. Oh, are we putting hands together for him? Yeah. Reverend Father Bright Kennedy Ejapon.
Nene chairperson. No, okay, pay me. And not bounce the second. And all other protocols duly observed. Pope Paul VI once said that modern man no longer listen to teachers but witnesses. And if they listen to teachers, then because the teachers themselves are witnesses. I don't think there will be a better way of demonstrating a bold statement here than to ask the vaccine team to give me my third shot of the COVID, the vaccine, to demonstrate my commitment, the commitment of the Catholic Church and the whole Christian community, that we are for the vaccination. So you give me just a few minutes, they will be done.
Oh, are you putting your hands together for Reverend Father? He's setting the example because, as we know, leadership by example. So the Catholic and the religious leaders are for the vaccination. So he's taking his right here. Reverend Father Bright ke solembilo Christofolio me wahe nge tupanog bumio emi. Eno ijo emangwe kepe kekle no kone watu epe wana kone monofendo noji Christofono oleka maunjamio chiwe tupanolo abuinog bumio inya. Enge no bue kone kegbuta epe no yemaha wanine wagbunlolo ne wohun wayagbun. Reverend Father on suro panier crowd. Obi ankabadista wa nenimbi rade.
So you see, it is good. Probably we're forgetting where we're coming from. A time when companies evoke the clauses of force majeure in their appointment letters, and people were asked to go home without any benefit. You have not forgotten that. The day Moderna announced that they were through with their first clinical trial, the U.S. stock market shot by $1 trillion by market capitalization. It tells you how damaging the COVID had been. I used to be in Koko, so Kwawu was a thing that I would so much know. In 2020, I had to go there with TV3 to cover them because they kept calling me, and my ears are on the ground exactly how people were suffering because of the COVID. They shut down Kwawu when we had about a month to go. This year, I'm sure you saw on social media and other streaming how people besiege their place. You cannot underestimate the market value of things to the people of Kabu and Ghana. And here in Somenya, we had fun. Now some of us can go out boldly without wearing the masks. Let us not forget, and as an expert in monetary evaluation, I did not joke with counterfactuals. What would have happened without the vaccine? And I'm happy Dr. Ofosu made it clear that let us not forget the fact that today the pandemic has gone down because there can be an upset or a research, and that it can come back again, and we can be taken by surprises. And so please, let's all go for it. Look, there are two ways that we can have protection, what we call herd immunity. That is immunity, indirect immunity from previous infection, and then indirect protection from vaccination. But WHO is going for vaccination. For that, we are sure that protection can be relied on. And so as a church, as a Christian community, we are telling everybody, let us all be charitable, because we cannot live without charity. We are here, we can go out freely because people offer themselves first to undergo the trials. People will risk their lives and being subjected to the trials before we could get this. Scientists had to work so hard, day and night, sleepless moments to get the vaccine for us. And those who are still carrying the conspiracy theories, stop. This is not a matter to joke with. Let us be charitable and support each other. Once the herd community is attained, we are good to go. Until we get there, look, many important people, as it were, in our society died. The last thing I checked, all those listening to me didn't die. And some of us, because I walked from here in May 2020, I walked from here to Kofodia to organize, to get support funds. And we're able to raise funds to buy PPEs for people. Some couldn't even afford soap to wash their hands, to buy even the face mask. These were challenging moments, and we all sacrificed. So if you are here today, the vaccine is here. Don't forget, people nearly paid political price for the vaccines. We are here today, and it's available. Please go take it, because tomorrow you'll be saving not only your life, but that of your family and the entire community. Look, the statistics are just baggling. We are saying that about 6 million people have died. But that is the official statement. Others are putting around 80 million. And here in Ghana, we have 1,445 thereabouts. Last time I checked once again, you weren't involved. So the vaccines are here, people work for it. The government has been involved with all the supporting agencies. Here we are now. I want to encourage each one of us, let's get involved, let's get vaccinated, save yourself and save your people. Thank you so very much.
Reverend Father Bright, God bless you so much. Please, if you come, I'm giving you just 2 minutes to do your delivery, because we are way away from time. So when you come, you just do that within 2 minutes for us. The next on the bill is Alhaji Hamza Gariba, Municipal Chief Imam. Let's put our hands together for him as he walks to the. Then Nene Nyewe, the Nyewe Divisional Chief Nene Akwatuaza, should be getting ready for the traditional ladies.
Thank you very much, MC. Nene, Chairman, all protocol observed. I think it's very important to also do what my colleague just did. Sorry. And mine is to ask the chairman to allow me invite the health workers to come to my community so that in front of them, I do it in front of them so that they see it for themselves. So with your permission, Chairman, thank you very much. And once again, I would like to crave your indulgence to allow me switch on to Hausa language for the benefit of my people. Thank you so much again. Yana ganin batun alluran gana COVID-19 ga da muke kiran shi corona ba wasa bane, gaskiya ne. Idan kana duban TV ko kana samun labarai, to ina ganin zaka san kaman gaskiya ake faɗi. Kuma abinda ake ce ma ta'un a cikin addinin musulunci, ta'un shine ciwon da yake ya gama duniya baki daya. Kuma a zamanin Rasulu Muhammad sallallahu alaihi wasallam an yi abu kaman haka na. An yi ta'un wanda yake manzo Allah sallallahu alaihi wasallam ya ce kar kowa ya fita daga garin da yake, kuma kar kowa ya shigo. That is exactly what we experienced here. Abin da muka samu daga cikin kasa mu kenan, ya kai inda aka bi na lockdown, aka ce kowa ya saura gida, kan wani ya fita kuma kan wani ya shigo. Shi yasa addini ne wanda yake ba abin da zaka yi ta gaddama ka ce ko wani party A ko party B ya zo da shi ba. A'a, batun ciyo ne, bai san sarki ba, bai san liman ba, bai san wanda shi wato dan wane ne, bai sani ba. Shi yasa naka ne ka kiyaye kanka. A Rasulu Muhammad sallallahu alaihi wasallam yace wato alwiqayatu hayrun min al-ilaj, meaning ka kiyaye kanka, ka kiyaye kanka daga wani abun da zai zo daga baya sannan ka zo kana neman magani. A cikin turanci, prevention is better than cure. Shi yasa mu yi hankali sosai, mu daina politicizing ciwo. Muna duban kamar ai zamanin wani kaza ne ciwon ya zo, shi yasa shi ya zo da ciwon. Wannan is out of the context. Shi yasa muna roƙon ƴan uwan musulmi su yi hankuri, wanda ya san bai yi alluran ba ya je ya yi. Amfanin kanka ne da kanka. Ni na yi allura, matana ta yi allura, mutane na sun yi allura, to amma kai da baka yi ba, wato ina maka gargaɗi da ka je ka yi, ga kadi na nan nayi. Sauran booster da zan yi, na roƙi sarki wato ya bani hanya a zo zango, a zo a yi, saboda kowa ya samu ya yi. Thank you very much for your audience. May Allah bless you.
Thank you, thank you. Oh, are we putting our hands together for him? Let's do it better. Okay, then now we are going to the traditional leader. And to do that for us is Nene Amwate Akpachu Azan. He is the Nyewe Divisional Chief. Let's put our hands together for Nene as he comes. Please, 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 please.
Ago hanye ilogono macheme manyeme ke inde koto mai na kwenga yo idazinge machema nanem wa kanye mambi meme ingmenye heblo na hane gumno ne wanga he munyutu no ne wanye ne wape vasi no nanga de no hia samenya ke ha wo chuepe ninga no mi mai ninga nye de ka ko wangu wa he ke ha na bum lo wangu wa ha na bum ha wo no e ma ha ne wa mana he wam ne ke wa na he wam ho wa manye majuni ne ke wa nye ne wa juni o amana sika ke wo wa kutukum ne ma pemini e ma ya no eno ninga de no ila ne mu madasi ngina ne no ne ma che ma iwa choma che kake ne la nwe ba ne ba gbunga ma hem nene bunasi obeno ke wa choma nye tino kake ba e ba wa Please, we want the health vaccine officers to come to our aid. Hello? Yo, nyechum. Ego penye nyakpeka igbu momo. Lo no go yani mache me bape ham. Enyone mangwe no sinano ka ha municipal MC ka nye bli wa hiyo cham hiyo nya hawo. Nyechum ka.
Oh, yamo yensemni. Wafia wademionehi. Yes, leadership by example. And that is what we are saying. Up next is COVID-19 surveyor, Madam Seriam Mfa Agbenya. Please, let's put our hands together for Madam Seriam Mefa Agbenya. She also have short message for us and within 2 minutes. Thank you.
Good afternoon, everyone. All protocols observed. I'm Syrian Mefa Agbenya. I'm a teacher by profession, and I happen to survive COVID-19. So 2021, in February, I was 3 months pregnant, and I had COVID-19. I went through the medications, and it didn't affect my pregnancy. After I gave birth, I went for the vaccine, and I've been fully vaccinated. My baby is 8 months now and healthy and strong. Nothing has affected my baby. There was no complications. I was able to deliver by myself without any assistance. So I want to urge everyone here, if you haven't taken the vaccination, please go ahead and take it. There's nothing wrong with the vaccination. It won't kill your baby. It won't have any effect on you, the mother. So I'll urge everyone, please take the vaccination because it's safe. Thank you.
Let's put our hands together once again for her. Thank you very much. That was a COVID-19 survivor, Madam Emefa. Thank you for that testimony. So before we go on with the rest of the program, permit me to introduce these other dignitaries. We have PEMT Diameke Moses from the National Ambulance Service. Thank you for coming. We have Mr. Theophilus Taki from the Ghana Red Cross Society, the Regional Director, Eastern Region, also here with us. Thank you for coming. We have DO1 Ebenezer Jabati, the Commander, Ghana National Fire Service. Thank you for coming, sir. We have Mr. Bright Amisa, the President, Ghana Coalition of NGOs in Health. Thank you for coming, sir. So I'll call on my co-MC to continue with the rest of the program. Please, let's stick to the time. We don't have much time on our hand. Looking at the weather, we want to close on time. But let me take the opportunity to announce that we have a vaccination stand just behind where they've been coming from. So if you are here and you have not taken any of the jabs, please make sure after we close, or you can walk quietly to that place while the program is going on so that you can get vaccinated. We set up purposely for people who haven't vaccinated yet to go and have their vaccine. So please, let's take advantage of it so that we can get vaccinated. Thank you very much for coming.
You are welcome. Thank you too. Then now on the program, we were going to be taking a short message or a word from the Honorable MP for Yilo Klo in the person of Honorable Albert Tete Nyakote, Member of Parliament. Let's put our hands together for him. Nene wawecha de loko je opeje ke bumi onga wasi nge agogo kofodu station onga lejon kosu lejon mohu amagmu amono keke oyoe. Thank you.
Ago anye go Nene Chairman, my hard-working MC, and all other protocols observed. My good people of Yilo Krobo, I bring you greetings from the 8th Parliament. Neneme, mwendo kiba hiyo, wanakamono wa nene, oklipeme, lehwenga hiyoji, ne MC unga hiyoji. Necho kanene wa mapemga hiyo wale kano, hiyawo samenya. Imi ni dasinga hiyo, imi bungu ete nchwepe. Nene la madenyeji, kenye da wanga hiyo, nukwa kwa wanga lake hanya nukwa bayone. Ke noko do ke ko bungu, oma vie, alo ko bungu, oma nu hiyo. Alo wajua meko wa bungu, watu obi pe huo, la nganye sisiye. Lo mono ko wanga hiyo, nene wa madenyeji, ke mone ogbuyon, obo modi, neka ba wem, alo about community, alo ke no senga yopo no ya bun. Eya kan ina nene COVID-19 pe ni fu colleague MP kake ne waje 8th Parliament osisiyon. Nyena kan kuno ko ba bo nene komena. ni ya ni anale ne fonse nge samio ilika ipale manye matesi nyeni nga yodio ekominga ne iweche njinye ekominga ebime ekominga enyemimme wasimire jamano epenoko loko na blonya ne akenno bawa constituency o ekonye kwa constituency pa ne na ese na adeji na kenno ba yilo constituency o wocho wagmu ne no pe fine kabne nye hinsi nga yo ninga nye ye wa manyeme ne nye pe fewlo wako hane nuku bande bagbawanya wasu jiami lo ike mahanye jinya ya ne jinya bana wo ne no fia no wangelayo no wande suno wako hane hiyoko bagbe wo wa macheme wa se mam ne wade wanyome kagu ne wa macheme kwa manyeme after nya ne yunge seno ne hiyoko bagbawanya lo nyechupa nyechum kibene agbenya adeke kenoko nake bayilo no pe papa ne adewo ke mono ho abli district hospital na nge chum hai sa chwe MPBE kemone ohie TV lo onu radio pam o mana kuno ndike ajuma menu wanu nge hospital o si MP le ni chumji lo ne e me ana kuno nake noba lo hospital na binya made MC ke ayeko ke hale imu magule jono ma hie ke no kni bwadwe hie ma qualify ni mai fire lo ka asbe na ma bli le trepe wa bomajo lo nye chumka mone ka
Yeah. This is the Honorable Member of Parliament for Yilo Klu. Once again, let's put our hands together for Honorable Nyakote. Let me use this opportunity to welcome into our midst or acknowledge the presence of the MC of Lower Manya, Honorable Simon Kweku. Yes, very humble but hardworking. Thank you for coming. Next is Pastor Nai Mensa, Impact Bible Church, Sumanya, with a short message. 2 minutes. Oh, let's clap for him. Let's clap for him.
Chairman and all protocols observed. Ikwanyepe corona neba eli osofo eli Christofono. Lohijo emini dasion igbu eten twepe iyo ke ibime agbun. Isafo biome fu agbun. Loma kwanyepe wakongo ke fie wagbun emaye bwawo kwanyepe nyechum.
Yes, brief indeed. Let's put our hands together for him. Then now on the program, we have some short, I can call it play or a drama by our brothers and sisters from Mount Mary College of Education. With a round of applause, ladies and gentlemen, let's welcome them into the arena for their short, very brief, short drama. Oh, are we putting our hands together for them as they come? Wanyemi meina je Mount Mary sukuwo angef ko ne amafia ke chonwo ehe kan eko COVID-19 no ehe aha lo anga he dry penanga dry no mango papun agbo ke fonsinge inyemi me manyeme ki mami me ahengme mi nikotoma meke wabeyopi lo boje mi onga hiye chon lo kepene beba mio machwa manye nokotoma nganye petio ebie keke nyecho penye mate sindasi ne wamana nye wonye ni no fine keke wanyanye nyechum kanye num sisi. Thank you.
ago hanye ihanye wama fiem kopem ne fiem yo eyi otiji hione ebana wonga wa mami ne brefolin wole bieke coronavirus alo COVID-19 hiono ebaye wo awi saminya lo heje esane wala blowing ano ne wakama no kuno kesi hiono lo heje nyeinsi nyekotesi ne nye hie fiem ne wamapem ne ma chon wani ne wamape kone hiono wamanye maye no kunim nyechum.
Ago here kamu. Neji dade mache nene ohranga ke etanyama. Se neji elinesu hiyo chali nkome ano kaje wa hiyo chami hiyo ne aka wa mani siem kako ko hiyo mi hiyo ne engani gbe patapata nge wa yilo ko pa nono ne aka ma sieni ka gun he ke benecha ne wa ma gun ke ma fie hiyo ke yase lo eke enganye lai huo motu nga ewi onya mle pago lo nyepe ko ne wochope wa pekake ne wa ke fie hiyo no kaje wa yilo ko pa no emile fie lo jimi o fie lo gbo
Nene Mao. 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 Neneke nye babaye neneke ebuajo wa ne enanyesi kan chamine echenye nye botue ne nyeba nye towe chile lo enanyesi
yo mabime enanyesi kan ne ifonide ka chenyo nyekpanye kwe no pam na nyeba kona nyemanu sane papa nenge ka hawo kpanye pe ochuwa manu ka hiyo ya ko ngebi nge ko hiyo enge ni magbaye ke sipui nenge me ahen patai wana ni kotome gbaja keje wacham hiyo me kona mabana ba chosewo kone zune ni ngegbe wa to mu ne angani plan wa tu yan wo ne han wa nyewe ne wa gmu chupa ka kun hiyo nya yamba kona ba blege jamane me ke han wo kone wana de kan no wana de no akegbu kone hiyo ko ko po wa hem e ko pata mo bi ya hemi nye wa mle hiam yo kone mane ya no lo bio no ke ma hiyo ma ko kone wa chali wo me aba kone ni anga ke han wo aba de wo
mambine nenene ne jiji no ne o okita me ipo pede ne ke blobli lo nye ba ne nye ba chose wo nenene nye ke ba
yo otiame mokasu nene no dia ke le tumio ke blonya ne ha wo mambime nye tumi kan ne nene chenye nye kpo nye kwese nye ba nye ba nu nene enge mono wa doctor yin ne wa je yo cha mi hiyo nwa ke ba ne wa ka nye ba tumunyu ka ko nene e ba e ke ko hiyo mi hiyo ko ne e ngegbeye ebane engani be ne lejema hiyo achele coronavirus alo COVID-19 ne nokoma bisike miniti lejema hiyo eji hiyo ya mi neke eso numero chuo mio e magbo numero chuo ne ko ebeni o mo numero ni che o magbo lo hiyo nokoma bisike kema peke kale kan ina hiyo no alo nokonga hiyo no ke nane o ma hie alo o kadino ma hie di no e mai romi pe ne ekwasi huma peka ekwasi wopa e ma dola pli se e komengene chapi COVID-19 no e o kadin lo e di ona ne sanope di osu etami yoko no ahia umuamka lo alo chapilo lo edio ango blonya tomekeba ne omaguno ne obi hiono nai alo ke ongekio e magbasi ke blonya ko nakeba di fo ode nganyu nengebe nya kejale no oka sanitizer hu wo ode ne esana opu gugonya kanya edukuo ne dokita ngwai ka nisi pali ngwai ahisi abomode na ngwai jwe ikepe ne ango chupa keba ne emango lejibani ndo mekla kebasi la maha ye doctor kakio blokone ekanye banyiro lo me ami nyechum
yo nene mochum enyi mi ne smo mochum se kabene enyi mi odion engem ni ne mobi aketupamba ne wonto wana kan tupano chapine ne emagbe hiyo se mo emaba hiyo si ne mahane hiyo ebi wonu ne emapo ahepie lono kuma bisike mene sakan agbo chupano se chupano e bake han ne ne ayejian nyoma kepa nyokeya ne di keke no ne ba se enyone no ne ba no le ake ne me na ayejian nyoma ke enu keya lono fe no ko ne yejian nyoma ke enu keya enge blokan egbo keke no ma chupano ko ne kepo ehepie ke wekuli ke hwen ke je hiya yam no he ne no kuma bisi ke jije ne agun chupa no nge ko ya ne ji wa hiyo cham he alo he pontin nga wa mamio o ma ya ne amaya gbuka ha mo ne no kuma bisi ke ahio sikalo ahewe sika se ne ne hia ji kan o mala Ghana cardio alo vote mi cardio enope dinene makaya apina nyale eno peji neno makaya keke amaya gbuka hamo loloko machano bimi kongelo yo Dr. Muchumi ikema bisika ye yuo efo hien pe lo anile ho emanye magunchupa no kolo
mo papa ma jomo o yuo le emanye magbon se jugun le ebinye magbon lo wa han le kan chupa no anakan yi holi hu hiyo manye manume lo hejo ape me hu achupon keba lo oyuo le emaya gbone neji yi holi eme achupon eko se bi mo yo le abigbon ke han le se oyuo le manye magbon eko miniji bi
yo mochumi ipa pe we imi ki hu no ne wange ne wanwe ka kin pok buchupa abai mongo ke ihu no agbuchupa abai mongo etungede lo ipa peke ni papa lo
yo lo mabinye ke nene sebi atuo tuweni one agbuchupa hielo dabi lo eji nyangomi alo hesan na nga wonga chupa e kanke o ya agbuchupa no sebi otuo enyamabasi alo emachi ofomnya ebemi ayeka chupa ebi jamanu pe ipa panga tebolo mine ko hu bi mi ko hu
What you mean? Say, ibi mi oji ake ni komingene ka agbon ke akoni meye. Ne wa mi hu ne mo hu loji. Ihu lo ike hie iyo ne ki agboju pa no. Ne ikoni miye. Ibi nyema yang mom logoji maka hie iyo kibi me lo ka ji leke. Okay, mo wacha wale kan kenyi ni ko ngane oyi gbele no yo. E ma nyamo. Nyele janle. Lo tupo no eji tupo hene e ya se no mletwo. Lo ke tupo no ba se no mletwo me. Enge how me alo nyagba bo ne keba. E ko meji ngane agbon mo nge e mayemo. Alo fie bo mayemo. Alo oyi mayemo bo. Ale ohemi mo chiche mo bo. E no tope bekpiti o pe kan hengmefia. Alo ngmefia. Pe keke eji. Le no me aji nyagba akene tupo eji tupo hene e ma se no mletwo me. Se bebo pe o manye machano ne o maya hu popo no sisolo
Yo chalo no kotoma ipo pe tanu chupa mabahio kwa na henum ka ni ne ayeji hanyo make banyo na magbo pio no nga omni tunge wanaka keno yeji hanyo make enu enga hebone gbu pio no wane ono maleka yo holi yo na hemi me hu amanye magbulo neke abegbuyo le me hio enumelo aloke hio nume ebenya gbam ko nge ano ochum
mo kabini de ke salamio hio no manye manu yo holo e manye manu jugeyo se akpasi na kan akane hio no manye manu mehejo aha ne tupa e ba muno ne jugu me ano ngekon iholi e manu hu ngekon loko nene me ne ayejanyo make panyo kaya me hu ano ngekon lo iholi tupa ne imi magbon pilo ne iholo magbon tupa ne jugu ne janyo make no magbon pilo ni mi magbon igwa pona me nyalo. Okay, lo ngeno wasuno inga bi ka meneme na angehio ne agbuchupa meneme na agbon nene me na agbon mahi academy mahi academy okay. Mahi academy. Okay, piono akeba kan ke ogbon enyon chope le ko bana tele ke booster ne lo le makanyan le wa we ne ji lo wi me nga wa mi on lo ko le kan ogbon enyon momo le jana le wa magbon ne ji booster ke hamo igwa iba ngan tebole se ne me agwe ko lolo le wa mahane amagbon ha me piono lo meneme na ngayo na agwe ko lolo meneme oh ma mo ne omi waki ke no no ngelejon nye ye bo ale ko ne e agbon nye ye bo ale ko ne agbon ba no wa
Ago.
Dokita ni koto mai. Hanya cumi ka nyeba chosi wonge beno ma pe hane waga mana hewami. Hiyo ya ne bano e babi wa hen patan yi. Ike chema opio ne wenye no. Kone mnyamu kwa ye batuno mabi hu ile ka amayum. Mabi ikpanye pe wa wamle hia nege wa no feno ko ngawade. Nyechumka
wa ben nene mene agbuju pon lolo aba kune aselai mene agbon me
Nene ke madenye ke chami ko chele nene hia kan enoke no le kwanye pe e mabinye bro kune e majenye bo nene mahwe no eje ohia wo ofu eji nene nga wa popa no
lo nene mene agbun lolo aba to line ko ne waya gbun han me o soko aiso nene mene agbun lolo aba to line ko ne wa gbun kan me fast
Many peng itu nya ke ko bu chupa lo dabi chupa no na ke ba no pya ke no mlo da do nye pya ke no mlo chupa no ite nya ke ko bu bo ke ni bu ka po ka posi bo ka yo mi no bo ka pe ki ko no nya ko bu chupa no isi no mi lo ngoy ma bi ono ko ken no ko bo yo o pa le ma aya ka a pe chupa mo lo
Debi le wa ko gbun mo wa bi gbun e.
ye o le limi lo tako ne egbon edo pe wole ne negbe
Debi o ili.
aha ma do fi ni teje mi o ake chupa no gumi o lo le gbeju bu won ne
Le wa bi gbun yo. Isi me mo gbo.
nyeba no wa o nyeba yeko gun
You. Au. Mai.
Dokita, nye bwa mi, no ko ngami pe. No ko ngami pe. Ah. Edonye.
Doctor ikpo pe ba here bi o han mi ebe wa me no chowele.
Ebewa esane wa run test no wa hear more. Wa hear more.
Ikpo pe here bi o han mi o.
Mami nurse also here hana wa hear more. Hana wa hear more. Mami nurse also no ke result oba ne so. Mami pete.
Doctor mi so ne.
Egbo. Mami nurse, my result lolo. My result. Oh, corona lagbele. Here.
Obina ki bi o. Anku ninu.
Yo, na chi.
Mi e bi ti ko na. Ona ka tuku ogbo. Egbo. Ona ka tuku ogbo lo.
Na chi.
Omi de ku akoko.
Na chi.
Oku akoko we bi ona ni we.
Mo mo na chi. Iko na chi.
Bana ba tele.
Iko na chi. Tabi lo ne gbele nyango. Iko nyango. Yo, la ko ke yo no yin. Ike. Le wa o, lamlem. Mi no wa no wa gun. Iko mlem ko no wa to wa gun. Yo, wa o.
Mochema no me kone abaken gbogbo no ka o. Mochema ba kone nye ba ke gbogbo no ka o.
Ago hanye. Chewo chope wahie fiamione eyano. Esisi choka ken wake wahe hawe ne amagbunwo. Corona abui ne emastronya. Le omana no kabene awinyi ke hunuo na hawe ne agbuhame ne abioji adio. Lo eje esane wo chope waba kone wabagbun corona abui na achaleke vaccination. Wagbun kone wanye no wadasi no waje corona dem. Aje ka ko onyake ogbun obua he no bua oweku no obua machope. Protect yourself, protect your community, and protect the family. Also come together and let's all fight against coronavirus as we protect our nation Ghana. Thank you.
Oh, are we putting our hands together for them?
Thank you very much. That was a drama by the Mount Mary College of Education drama troupe. Thank you for that performance. Very educative and informative. Let me say that throughout our fight against the COVID-19 pandemic, we have received a lot of support. Please, can we have some silence? The program is going on. We have received a lot of support from our partners, and we continue to receive support from them. And as such event is proper and praying for us to give them the opportunity to say some few words. But looking at the time constraints and as well as the weather, we will plead with them to allow us so that we can limit the number of partners who are going to speak. So please bear with us. Thank you very much. So I'll call on the WHO country rep in the person of Dr. Francis Kasolo to give us a brief statement. Please help me welcome him. Okay. So I've just been prompted that all the partners are combining and WHO is leading the brief statement. So please, partners, if you are here, kindly join him so that the statement can be read on your behalf. Please join. All partners kindly join. UNICEF, USAID, JICA, World Bank, CDC, UK Aid, PAF, LDS, JSI, EU. Please, if you are here, kindly join. As well as others who were not mentioned, if you are here, kindly join. Thank you very much.
Thank you very much. Nene Chair, the paramount chief of the Iloklu traditional area, the chief executive of Ilo Krobo municipality, the Honorable Eric Tete, and members of parliament present, and all the political leadership of the Eastern region and beyond. Our friend, the Director General of the Ghana Health Service, Dr. Patrick Kumar Boaji, the Regional Director for the Eastern region, directors from the Ministry of Health and Ghana Health Service, colleague, development partners present, distinguished traditional and religious leaders, health workers, students from health and educational institutions, our mothers, fathers, sisters present, friends from the media, and should I say, ladies and gentlemen, good afternoon. On behalf of all the development partners present, I would like to join those who have spoken earlier in acknowledging the efforts of the Ghana government in ensuring that as many of their citizens are vaccinated against COVID-19. The second national COVID vaccination campaign being launched today here in Somania is a step in the right direction towards ramping up coverage and reaching the target of 70% fully vaccinated by 30th June 2022. Neneche, it seems like yesterday when on 11th March 2020, the WHO Director General, Dr. Tedros Adhanom Ghebreyesus, in line with the international health regulation, declared COVID-19 a global pandemic. At that time, fewer than 100 cases of COVID-19 had been reported outside the then hotspot of China. 2 years down the line, all countries in the world have reported at least a case of COVID-19, with over 503 million people infected and 6.2 million deaths reported. Thanks to investment in research and technology, as well as global partnership, safe and efficacious vaccines against COVID-19 became available towards the end of 2020. Here in Ghana, government working with multilateral and bilateral partners has managed to secure over 30 million COVID-19 vaccines for everyone living in Ghana. In addition, Ghana has rolled out one of the most efficient COVID-19 vaccination campaigns within Africa, and all of us, the development partners, are proud to be associated with this success. Congratulations to Ghana. Nene Chair, despite this success in the vaccination rollout, it is important to note that the pandemic is far from over. The drastic drop in the number of daily cases and deaths that we have witnessed over the past 6 weeks is only a reminder to all of us that we need to work even harder to ensure that we do not have any new spikes in cases, as is currently being witnessed in Asia and Pacific parts of the world, for example. COVID remains a threat to all of us as long as cases exist else somewhere. It is also not worth noting that if COVID-19 virus continues to circulate, the more opportunities it has to change its form or mutate, just as we saw the emergence of the Omicron and related subvariants. The only way, therefore, to slow down this virus from mutating and spreading is by ensuring that all public health measures, including vaccination, are fully implemented. Nene Chair, distinguished ladies and gentlemen, it is also important to note that COVID-19 vaccination significantly limits transmission chains and in so doing protect the community from COVID infection. For those vaccinated, it is, if you unfortunately get infected, you are likely to develop a less severe form of the disease and may not require hospitalization, thus helping reduce the patient load on the health system. Unfortunately, despite the freely available COVID vaccine, we still have pockets of resistance across the country, largely due to rumors and disinformation. I would, on behalf of all the development partners, therefore, restate that COVID-19 vaccines are safe and have saved numerous lives across the world. I and my colleagues, the development partners present here, for example, have been vaccinated and have not developed any unwarranted side effects. My Ghanaian brothers and sisters, go out and get vaccinated, as this is the only way that we can collectively get back to living normal lives. Nene Chair, in countries which are facing a surge in number of cases, the heartwarming information we're receiving is that the number of cases is not as was seen before the vaccines became available. This in itself is a clear indication of the impact of vaccines have had against the fight against COVID-19 in these countries. In concluding, I'd like to encourage all of us to join the fight against this pandemic. We need to say no to misinformation and rumors on COVID-19. We should take every opportunity to share the correct information on COVID-19 with our friends and our families. COVID-19 does not know tribe, religion, color, or political affiliation, and therefore, let us all go out and get vaccinated and save our community. On our part, as the development partners, we will continue to support the fight against COVID and accompany Ghana on its road to achieving better health. Together, we will end COVID-19 in Ghana. I thank you on behalf of the development partners.
Let's put our hands together for them once more. Up next on the program, we're going to take in the keynote address from the official. The keynote address and official launch by Honorable Eric Tete, Municipal Chief Executive of Yilo Krobo. Oh, okay. Sorry, pardon me. The update on COVID-19 vaccination roll out in Ghana. Dr. Patrick Kuma will be doing that for us. Let's put our hands together for him.
Thank you very much, Honorable MC. Nene Chair Cleme Noena Sasaku II, Honorable MC, Honorable Eric Tete, representing also the Regional Minister, Honorable MP for Yilo Krobo, Honorable Albert Nyakute, representative of the WHO, Dr. Francis Kasolo, who is always on the field with us, our development partners here present, the Regional Director of Health Services, Eastern Region, Dr. Fosu, Directors of the Ministry of Health and Ghana Health Service, the heads of ministries, departments, and agencies, our traditional and religious leaders who have demonstrated something very unique for us today. Thank you very much. Distinguished invited guests, the media, ladies and gentlemen, all protocols observed. And now it's good afternoon. And my speech was supposed to be good morning. I am delighted to be here to launch the second national COVID-19 vaccination campaign. Let me first thank all our hardworking staff all over the country for their immense contribution towards the fight against COVID-19 pandemic. And I must say that a lot of them have not rested since this disease came up. They have been our gallant soldiers, and I salute them for their tireless efforts. I am particularly grateful also to our development partners who have supported us in diverse ways in the fight, and all individuals who have committed their time and resources and efforts to fight against this pandemic. I say a big thank you. Nene Chair, allow me to quickly highlight the fact that the fight against COVID-19 pandemic is not over yet. Yes, it's true that our active cases today is 24, the whole country, but we have so far recorded about 161,124 cases. We have sadly lost about 1,445 persons, and this includes close relatives of mine. We need to completely win this fight, and it is in considering this that we have all gathered here to launch the rollout of a series of vaccination campaigns against COVID-19. The Ghana Health Service started the rollout of COVID-19 vaccine in phases among segmented high-risk populations in early March 2021, after the launch by His Excellency, the President Nana Addo Dankwa Akufo-Addo. The survey has since expanded the vaccination exercise to the general population, including pregnant women and children aged 15 years and above. The delivery of booster doses have also started for those who qualify to increase the immunity levels of the population against the COVID-19 disease. Currently, 5 COVID-19 vaccine types have been authorized for use by the Food and Drugs Authority, namely AstraZeneca, Sputnik V, Pfizer, BioNTech, Moderna, and Johnson & Johnson. As of the 18th of April 2022, Ghana had received over 30 million doses of COVID-19 vaccines and distributed most of them to all the regions and districts. To ensure these vaccines remain safe as they are being deployed, Ghana has strengthened its robust vaccine safety monitoring system that is managed by the Food and Drugs Authority with the support of the expanded program on immunization of the Ghana Health Services. To ensure real-time data management, the Ghana Health Service has deployed a well-integrated information technology and data management system that ensures successful vaccine distribution, tracking, monitoring, and reporting in near real time. With support from partners, the service is ardently working to ensure all paper-based data uploaded electronically for easy retrieval and use for decision making. Nene Chair, vaccine and cold chain management are critical for a successful immunization activity. In view of this, the government of Ghana, with support from the World Bank, government of Japan, and other partners, have supported the service with ultra-low freezers to store Pfizer's vaccines to enhance COVID-19 vaccine deployment. And I must say that we have ultra-cold fridges in all regions of the country. Additionally, the cold chain infrastructure and walk-in cold rooms are being pursued in the 6 new regions, and refurbishment of existing cold rooms are also ongoing. All these efforts are being made to ensure that vaccines are always kept at the required temperature to ensure vaccine potency and safety. Nene Chair, I would like to highlight at this point that Ghana Health Service has taken note of the concerns of the general public, especially in the area of those, some of the areas sort of those complaining about the side effects among others, and we are working ardently with the risk communication to cover up. Distinguished ladies and gentlemen, the vaccination exercise coupled with adherence to other preventive measures are yielding results. Currently, the service has deployed nearly 14 million doses, with approximately 10 million persons having received at least a dose of COVID-19. The COVID-19 pandemic, as I said, is not over, but the fight has rather intensified, especially so following His Excellency the President easing of some restrictions. This is a time to take steps to build our immunity against the virus. Vaccination offers the best and the safest option. Taking a cue from what is happening around the world, including a surge in China and other countries, Ghana stepped up efforts to vaccinate its initial target of approximately 20 million persons by the end of June 2022. And we hope that this is going to be a major catalyst to achieve this. To ramp up the vaccination drive, a series of vaccination campaigns have been planned to take place across the country. Distinguished ladies and gentlemen, Nene Chair, as you may recall, the first national COVID-19 vaccination campaign was launched by the Honorable Minister of Health and successfully conducted in early February 2022, during which over 2 million doses of vaccines were deployed within 5 to 7 days. The second national vaccination, COVID-19 vaccination campaign, for which reason we are here, starts today. Thursday, the 21st of March, or to Monday, 25th of April, across all the districts and the regions in the country. In the next 5 days, approximately 6,000 vaccination teams are being deployed across the length and breadth of the country, employing different strategies such as using traditional clinics, hospitals, health centers, CHIPS compounds, these are status points, to reach the people, as well as close to client strategies to be used, including outreach points, mobile clinics to reach the unreached, vaccination teams to establish temporary posts in markets, lorry parks, schools, churches, mosques, sports stadia, offices, and other areas where people may crowd in order to effectively deploy COVID-19 vaccines, with a target of 2 million additional doses to be deployed within these 5 days. The aim of this campaign is to ensure that Ghana achieves its herd immunity, especially now that COVID-19 cases have gone down. It is important to know that this is the best time to protect yourself and your loved ones when the cases are low, because that is when we build your immunity to prevent the next surge should it come, as also elaborated by the WHO representative. Ladies and gentlemen, it is critical to note that vaccination does not end when the period of vaccination campaigns ends. COVID-19 vaccines will be available in all our facilities thereafter, as we continuously deploy until the entire eligible population is adequately covered. Ghana, like most other countries, is challenged with misinformation, disinformation, myths, rumors leading to vaccine hesitancy, affecting vaccine uptake. Extensive use of various communication materials and tools are being deployed by the service and its partners to address this critical barrier of hesitancy. We humbly request the public to seek for the right information and not to allow rumors to rob them of the opportunity to take action to protect themselves and their families against COVID-19. Distinguished ladies and gentlemen, allow me at this juncture to highlight effective and free. The Ministry of Health, Ghana Health Service and partners are determined to end COVID-19 and reduce the impact it has on our lives and people living in Ghana. It is time to do your part by getting vaccinated. Nene Chair, vaccines save lives. This has widely been demonstrated in children, especially. It is evident that one major contributor for health, to health of children in Ghana and indeed the world is immunization. The Ghana Health Service will continue its efforts at reaching all eligible persons in Ghana with potent vaccines to fight disease among children and adults. The importance of routine childhood vaccination needs to be emphasized continually, even as we fight this pandemic. It is in the light of this that I call on all Ghanaians to support the gains made so far in the Ghana's vaccination program as we commemorate this year's Africa Vaccination Week, that's the World Immunization Week, from 24th of 30th of April 2022, which will be just around the corner next week. Lady Chair, ladies and gentlemen, I wish to take this opportunity to once again thank all our partners, my hardworking and gallant health workers at all the levels who continue to work tirelessly to ensure every eligible person is vaccinated against COVID-19 as well as childhood preventable diseases. The government of Ghana is committed to ensuring the total well-being of every Ghanaian and is ready and willing to explore all available interventions to reduce the effect of this pandemic. Together, we shall all overcome. Nene and all, thank you for your attention.
Thank you very much. Iba openene denga afranet binyoma pelek pitio keklekle ina nene mesi ne enyo nehu ina leliche enichuli neji Ghana Health Service ni feno kone hiya kan wai wamnam yemo hamechum eke aje blonya tumlo akpa abuino gbumno he bonga ko foduya ne demandi glo no kama awoli gbipago no nimni baba oji ni ne agbun se hu ke basupio no akpawe ijaka anaka hiyo pine inge joy kla lulu jana ngo sina gbo ke hanene ji yem ke boam kuyi na je makpan ano ne anwo yem ke boam ke bahanga na ke gun brono no amagu ne tupan na to abia muno ete no ma na eko ne wagbon e ha mehu chum etano ne tonya ka piono abwa ai modi samenya ne apenu ko na tele ke code room pene piane tupan no esime ne dollar ake matole jon fine pene piane tupan me be fe bem na ma je mi po anyene atuni fine nge wanumlo chumi etano ne etonya ka piono tupan angala ne no fe no ko boy modi ka Emmanuel nga henenge eno hijio amaboy modi ka go radio mano TV o mano gogo fiam he o mekano mechuwepeo ama intupa no e gogo fiai kone no fene ko ya ne e agbun etonya kan be fu be mi woni fu wa ya dio ni pan ka kotupa no e ke ton wa nyemime ne tapija ne enge lo e ke jama munyu aken e hane ni fu anwe a ika bum se manyema de woka nene manyema po wa ipie ke maji COVID-19 no e dempedi kan wa malwa wone tupa ne bana ngmuyo no fene ko e agbun eko itano ne tonya ka tupa ejua ajwawe free ko ya pia magbon amu nene nyamo pedi ka o man Ghana ka keni nto wi ko mina mabimu o me onyene ojenya keke agbon amu tonya ka jukuwi na eke de nyoma ke enu ke ho no fen ko manyene e magbu tetepo yo oli umpon angenene amagbu hame e dai no ne ngosina agbo ke ha peniche ke asafa ke weto macheme ke jana asafa cheme manyeme kajano se unkoto mane hiye wa yo chamblo nya tomio no nge wakpukpa no no nge yo agbo kan aluame ne apete nene ji COVID-19 vaccination iblonya tomi bokpam nene no enyo no ne wakeba yilo klu nge yo nene nga de peji kan mono fen koko ya wemio lua mo ne ofie tupa no gbome sande papa ke onyemi kono nyemi ya do nyemi ne wotu wepe eko kekola Ghana mabi tu wepe wanyene tupa no wagbun eko munyi netu ekpeti opupe dinone nyefi adem hale. Okay, now I've gotten to where I jumped to, and for that we were supposed to have the regional minister in our midst to do that part, but because he's not here, we are going to invite the Honorable Municipal Assembly, the chief. He is the owner of the place. He's standing in the fruits and the empobois of the president himself. So, Honorable Eric Tete. Thank you. Let's put our hands together for him.
Mr. Chairman, Director General Ghana Health Service, heads of partner agencies, Regional Director of Ghana Health Service, directors from the Ministry of Health, Ghana Health Service, NMA,
Ladies and gentlemen, it is my greatest pleasure and honor for my region to be chosen as the venue for the launch of the second national COVID-19 vaccination days and the opportunity given me to deliver the keynote address at the formal launch of this campaign. I bring you greetings from the Eastern Regional Coordinating Council. On behalf of the chiefs and people of the region, I wish to formally welcome you to Somanya, the capital of Yilokrobo municipality in the Eastern region of Ghana. After the program, please find time to visit the market and get for yourself some locally made products, especially the much touted Krobo beads. Mr. Chairman, I would like to commend the Ministry of Health, Ghana Health Service, and the Regional Health Directorate for the dedicated efforts they've put in place to ensure that we all survive this pandemic. As a country, we've risen through the dark days of partial lockdown in certain parts of the country, the closure of borders, mandatory wearing of face masks, and general observation of COVID-19 protocols. At some point in time, businesses had to close down, and through this, some of them folded up and had to retrench their staff simply because they were out of business due to COVID-19. I'm saying all this to remind ourselves of where we've come from as a country in fighting this disease. It took the interventions of all stakeholders to ensure that we limit the spread of the disease, of which my region was not spared. Mr. Chairman, the distinguished ladies and gentlemen, the theme for this lunch, protect yourself, protect your family, get vaccinated against COVID-19, is most appropriate as it will offer more sensitization on the need for us to serve as check on each other to get vaccinated. I'm happy to note that through the collective effort of government, Ministry of Health and the Ghana Health Service, in collaboration with other sectors and stakeholders, we are gradually coming to normalcy. Our land and sea borders have been reopened, and now His Excellency the President of the Republic, Nana Addo Dankwa Akufo-Addo, has announced that wearing of nose masks is no longer mandatory, and the observation of most of the COVID-19 protocols has been relaxed. Businesses are now picking up and the economy bouncing back gradually. Through the effort of government, our vaccination exercise has been successful, and it's of no coincidence that we are currently having fewer reported COVID-19 cases as presented by the Director General of Ghana Health Service. I'm not a scientist, but I strongly believe that the reduced cases of COVID-19 has been largely occasioned by the concerted effort by all stakeholders to ensure that we vaccinate ourselves and our community to give us the needed protection. Distinguished ladies and gentlemen, in my interactions with people, I've come to realize that with the announcement by His Excellency the President to the fact that wearing of face masks is no more mandatory, people have taken it to mean that the disease is no more. Easing restrictions does not mean the disease is no more. We still have the disease with us. And to our experts, even one case of COVID-19 disease in the country is a cause for concern. We should remember that on the 12th of March 2020, we recorded our first 2 cases, but within a few weeks, our cases increased astronomically. What it means is that we still have a responsibility to make sure our communities are safe by canvassing for all eligible people to get vaccinated against the disease and ensure that whenever we enter our crowded places, we put on our face masks. We should not think that we are out of the woods yet. The seeming happiness that is engulfing our people needs to be checked until we are free from the disease totally. A lot is required of us to ensure that we move to our communities to engage them to take the vaccines. Neneme, that district chief executives here, religious and other opinion leaders gathered, and at home, I plead with you to support all the efforts by our health workers to ensure that we are safe through vaccination. To our media men and women, you also have a bigger role to play. I will entreat you to use your platforms to encourage people to take the vaccine. Do not spread information that has not been verified by our health authorities. Support them to address misinformation by educating the masses on the need for all eligible persons to take the vaccine. We do not want to go back to the old days of hundreds and thousands of active cases again. We want to return to our normal life where we can freely interact with our friends and loved ones by seeing their faces. Let's embrace the COVID-19 vaccination exercise that has started today. I'm told that even after the campaign days, you can still visit selected facilities within your regions, districts to get vaccinated. And the chairman, as already stated by our health authorities here, we did not be complacent and relent in our efforts. We can experience another surge in cases if we do not take our destiny into our own hands. I'm therefore appealing to every resident in Ghana who is eligible for the vaccine and has not yet taken it to do so at the designated vaccination centers within their communities. Health authorities indicate that second special campaign starts today, 21st, and ends on 25th of April 2022. Let me quickly add that even after this campaign, vaccines will be available in all health facilities for those who, for very strong reasons, are unable to turn up for vaccination during this campaign period. Together, we can protect ourselves, our families, and our communities. And the chairman, ladies and gentlemen, before I take my seat, permit me to use the occasion to commend the Director General of Ghana Health Directorate and his team of experts, as well as other stakeholders at the national and regional levels.
Once again, let's put our hands together for the regional minister through Honorable Eric Tete. Okay, I think we are gradually getting to the end of the program, and this is where we've gotten to. Now I will go and give the microphone back to the owner of this land, the father of all, Kono Oklepeme Noe Anoba Sasraku Nenono Enyo the second. It looks like I'm using the word, I'm saying Okelpeme, and a lot will be asking what is the meaning. It means you are bigger than everybody, all of them. You are bigger than all of them. Apart from God on the Krobo land, he is bigger than all of them. That is the meaning of Oklepeme Noe Anobra Sasraku Kaki Pe Ekobeku. So he's the chair for he's the chairperson for the occasion. I'm going to give back the microphone to him for his closing remarks. Let's put our hands together. Whatever them penen and mawo enyagbe munyo nge blonya tomio edem.
Ago Nyechumka. Thank you very much. We are so very grateful for the efforts and the tirelessness of commitment put into the management of this COVID pandemic. That as you sit now, Ghana is being marked as one of the nations that has been able to effectively manage this pandemic. On behalf of my chiefs and team members, we are also glad to hear from the regional just hope that we didn't cite any of the beautiful ladies, as Mr. MC indicated. That would have been trouble. If that is what he cited to and is now bringing this thing to us so that he will cite more, then we have to check him. But on the more serious note, it is very critical and very important for us to take this COVID issue as a thing not to play with. But Director General, I mention your name because as it is now, you are standing in for the government in terms of health management. We'll claim your indulgence that you do very well to clear the air concerning the misinformation that is going on, which is demoralizing the people from going to take the vaccine. For instance, the question is, if President is saying that it's not mandatory for us to be in masks, the protocols has been lessened, as Mr. MC stated, then why should we be pressurized to go and take vaccine? Why should it be a compulsory thing for us to take vaccines? But I think we should let the people know that this has been possible and this has been achieved because of the vaccination. So that will be clear to the people to know that it is because of the vaccination that is why we could lessen these restrictions. So if you are there and you refuse to take the vaccine, then now you are becoming a danger to society. And for that matter, it is very necessary for you to ensure that you take the vaccine so that all of us will be released from this imprisonment of these protocols. Director General, we are thankful and we know that with the successes chalked so far, we are not going to be complacent, thinking that as indicated by the regional head director, for instance, Eastern region, currently we have 0 active cases in respective of this Kwewu thing that has happened, that some of us were scared, but then still we've been able to manage the situation and we don't have any active case. So we plead on the government to continue with a commitment in providing all logistics needed, strengthening the supply chain system to ensure that everybody will have access to the vaccine. Everybody will have access to the vaccine on time, that there will not be situations where people will go to facilities or places to take the vaccine and they will say we don't have vaccine. But we know and we are sure that this is not going to happen because we know the work that the government and the Ghana Health Service, Ministry of Health, has put in place for us to get this far. On behalf of my people, I would say God bless you all, and God bless Ghana, and God bless Ilo State for this fruitful event. And as I said earlier on, it will be said that after the launch in Ilo Krobo, the rollout of the vaccination throughout the country has been exceptional. I also not forget our development partners for the role they've played, not just giving us money, but also spending time, as the Director General said, to be on the field with our team to ensure that this rollout has been successfully and effectively implemented. We appreciate. God bless us all.
God bless us all. Let's put our hands together for Beniche Okotoblida no hilo. Oklipeme Noe Anoba Sasraku. Once again, let's put our hands together for him. Then now the closing prayer. The vote of thanks first, then the closing prayer comes. Then we are inviting Mrs. Irina Ofe, the Municipal Director of Health Service, Yilo Krobo.
Thank you very much, MC. Nene Chairman. Oklepeme Noa Anabasa Strakud II, the corner of Yilo Krobo traditional area. Director General, Ghana Health Service, Regional Director, all protocol observed. Indeed, a great privilege and honor to be called upon to give the vote of thanks on this memorable day, launching of second National COVID-19 Vaccination Days campaign. First of all, we give thanks to the God Almighty for His grace and gift of life, for allowing us to gather here today and seeing us through out the program and giving showers of blessings in the morning. Nene Chairman, we are grateful to you for accepting and chairing this all-important program to a successful end. Indeed, leadership starts by example. You showed us to that. Nene Mochumka. On behalf of Yilo Krobo Municipal Health Directorate and entire Yilo Krobo municipality, we want to say big thank you to our Honorable Municipal Chief Executive, Eric Tete. Honorable, we are grateful for stepping in the shoes of Regional Minister, delivering keynote address and launching the program for us. Thank you for your advice and support in organizing the program. We are grateful. Director General of the Ghana Health Service, Dr. Patrick Kumaubaji. We want to thank you for your presence and update on COVID-19 vaccination rollout in Ghana. It was so insightful, and we pray for God's guidance for you. I wish to express my gratitude to my Regional Director of Health Services, Dr. Vintred Ofosu, for providing continuous support and encouragement. Director, thank you. We are immensely grateful to all our partners in health, WHO, UNICEF, USAID, JICA, World Bank, CDC, UK8, PAF, LDS, European Union, and others, for their support and commitment. Indeed, your support has been of tremendous importance in generating the current momentum for the success in the fight against COVID-19. And we appeal for continuous support to accelerate efforts to control the spread of COVID-19 and to achieve COVID-19 vaccination coverage above 80% in Ghana. Again, I wish to express our sincere appreciation to all our stakeholders for their words of encouragement and motivating others to get vaccinated against COVID-19. I must mention our deep sense of appreciation to the custodians of Krobo land, our chiefs and queen mothers. We hope that you all support us in educating community members on the appropriate COVID-19 preventive measures and vaccination. Nichumka. Nene Chairman, ladies and gentlemen, an event like this cannot happen overnight. The wheel started rolling weeks ago. It required planning and a bird's eye for details. We have been fortunate enough to be backed up by a team of very motivated and dedicated colleagues from National EPI Program, Eastern Regional Health Directorate, Yilo Krobo Municipal Assembly, and Yilo Krobo Municipal Health Directorate, who know their job and are result-oriented. You all deserve congratulations for a job well done. We also express our thanks to all media persons present here and our special appreciation to Right FM of Somania and their CEO, Nene Davis Kobo, who offered his station for free announcement and radio discussion on COVID-19 since March 2020. I also extend my appreciation to Ghana Police Service, National Ambulance, National Fire Service, vaccination teams, students present, Montgomery College of Education Drama Troupe, and everyone whose presence here has contributed to the success of today's program. Our able MC and co-MC, we are also thank you for a great job done. Nene Chairman, ladies and gentlemen, once again, I want to state that we are most grateful to all present here. We thank you for being with us this morning and afternoon, and it has been a great pleasure. Let us all remember that COVID-19 kills. Get vaccinated. Thank you very much. God bless us all and Mother Ghana.
Ili kan awule de debia kunga hiolo lo manyamenye la de debia kune wa awule jakamono le etukulu bisaminya ekenene mutum nene ede opeti opeji hawo tuwe petum kanofeno kune nuno no ineba jano se hu wabomodi kan wake wa emawom kune nitum no ne eyemu hene waswo fiam ne ngajino ne. I have some short announcement here and it reads like all officials from national and partners, regional officers and partners, head of departments and district directors and superintendents. Please, from here, we are all going to Somanya Royal Hotel. Yeah, Somanya Royal Hotel. That is where we are going to take our refreshment. The remaining of us should just be in our seats. Our refreshment will come here. But remember, we are all moving, not all of us. Kono, the directors, and the municipal chief executive are all going to the new facility. They are going to the place before from there they will be going to the refreshment center. I said it, but I'll say it again. Officials from national and partners, regional officers and partners, head of departments and district directors and superintendents are all going to Somanya Royal Hotel for refreshment. The remaining of us will be sitting here and will be refreshed as well. So nobody should wake up, sit down, and you'll be refreshed. But remember, the directors, Kono, and the MCs are all moving to the new facility. They are going to the place, then from that place, they'll be going straight to the Royal Hotel. Thank you very much. Now, we are going to take our closing prayer, and to do that for us is Alhaji Hamza Gariba, Chief Imam. Let's put our hands together for him as he comes. Right after that, Kono and his entourage would wake up before any of us make a move. Thank you.
Thank you very much. Shall we pray? Since we are in the Quranic month, the Ramadan, we are going to say the prayer in Arabic. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين إياك نعبد وإياك نستعين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. Say Amen. Thank you very much.
Ikpanye pe woto pe wate sidasi oklepe me okoto blijano hilo no ano ban sasraku ne no enyo ewohe no nene wohe no kono wohe no aha kele eje gwami pe ke ko woto pe wo na blo no wa mahu wa manye maje gwami nene mene pia me all of us should just be in our seat They will be giving us nice music as our refreshment comes to us straight from wherever we are. So nobody should wake up from here. Just sit down and wait to be refreshed before you leave this place. Thank you all. God bless you all. And please go and vaccinate, because that is the only way we can get away from COVID-19. God bless you all. Maune Jonye, Nyamin Siramo, Imba Jonye, Jeruadon. Thank you.